you. Salamat po. Ang aking degrees, dahil sumisip-sip sa UP audience, puro UP. Sige. Sabi ni Doktora, dapat you should trust your doctors. And I'm here to tell you that you can't, because I'm going to tell you very different things from what she said, unfortunately. So no, you can't trust us. We confuse you all the time. It's another experience that you probably know. And my personal advocacy, I'm sure Dr. agrees with this, is you really have to be a very smart patient and to approach issues of medicine and science by reading for yourself. Again, Dr. and I probably will have common unity in laying all our cards on the table. So I'm going to say several things that totally contradict what Dr. says, and I'll leave it up to you. And on the evidence-based side of the debate still, and I leave it up to you, bahala na kayo kung paniniwalaan niyo siya, ako, sarili niyong paniniwala, o babasa pa kayo para mas lalo niyong matutunan. Kung alam ko lang na labanan ng white coat, Doktora, eh. Wala akong white coat. Sige. So let's go on with the my own PowerPoint presentation, and let's go. Next slide, please. Siguro I'll skip this kasi I really asked to follow on from Doktora kasi related ng aking presentation about it, no? So I'll let you. This is the definition of reproductive health. It's in ICPD. Let's move on na lang siguro. I can leave these slides with you. Okay, these are just, okay, let's stop there. Please go back. Okay, let's go to the first issue. No, forward, one slide forward. There you go. Okay, so ito yung whole gamut of family planning services. Gusto ko lang linawin na marami nga siya. Family planning, maternal and child health, prevention and management of abortion complications, prevention and treatment of RTIs, STDs, HIV and AIDS, education and counseling on sexuality and health, breast cancers and other conditions, gynecological condition, men's involvement in reproductive health and their own reproductive health, adolescent reproductive health, and vow. This is lang sa sinasabi ni Doktora, laying our credentials on the table. I was the founding secretary of the very first Rape and Violence Council, Rape and Violence Against Women organization in the entire Philippines, private or public. In 1988 namin sinimulan. It's called the Women's Crisis Center, and it has never been a choice between pregnancy and violence. Hindi nga totoo na okay lang ma-vow kung hindi ka mabuntis. Pero one of the reasons that I think we should take cognizance of the need for contraception, including emergency contraception, is a lot of women. I've been counseling for free for the last 20 years. I've never earned a cent from my medical work. Ang bumubuhay sa akin yung maliit naming sweldo sa UP dito. But I have counseled innumerable rape victims who got pregnant and who sometimes come to us and have sought an illegal abortion because of their desperation and have died. So for me, I don't want to dichotomize the needs of women. It has to be all. It can't be one or the other. And as a health professional, it should not be a choice between tuberculosis and family planning. It should be for the sake of our people, for the sake of poor people. Just because they're poor, we must not let them choose. They must have everything. No? And so, vow, and then prevention and treatment of infertility and sexual disorders. Move, please. Okay, so what are the statistics? You know? There are 3.4 million pregnancies, 1.8 million unintended of them, 4,700 maternal deaths, 450,000 maternal complications, dami, no? And 570,000 induced abortions, 1,000 of which leads to death. Let me tell you, who are statisticians here?
Demographer.
Yes. Our problem with zero maternal mortality statistics, like in the slide of Doctora, for certain areas is when you look at the number of maternal deaths per millions of population, you will really get zero if you limit the count to a particular barangay, even province, or certain areas. Ang sense ng counting maternal deaths cannot be assert a small number. Question of what is the population size that you need, diba? So, with due respect to the Doctora, I very much disagree with that slide. And I think the demographers and statisticians will agree with us that we can do that count in many barangays, in many series of barangays, even perhaps at certain times at the provincial level, depending on the time frame, and we'll get zero. That has nothing to do with questioning these heartening statistics on maternal health. So to say na zero dito, and zero dito kahit wala silang contraceptives, I think is not a fair conclusion to make. No? So let's proceed from there. So the next slide, please. Ito yung present Congress, sino yung mga nag-sponsor ng bill. So para lang sa kaalaman ng lahat, hindi pa nila na puput together yung bill, marami pa ang bills. Pansin namin nga, habang tumataas yung polls for population, tumataas yung polls of people who agree with the RH bill, dumadami sponsors. Si Risa lang talaga yung isa sa mga consistent, na kahit hindi pa siya popular, sorry kaibigan ko siya. Obvious ba? So may I have the next slide, please? So, what are the provisions, no? Or, the policy frames? And I believe all of these frames are in the bills, and I think what RH is all about. Human rights, gender equality, of children's welfare and rights, access to RH info and services, and the eradication of discrimination in the exercise of sexual and reproductive rights. Proceed, please. And the guiding principles, as you can see, informed choice, protection of all persons' rights, human resource development as part of health on RH, and let me say that reproductive health services in the minds of WHO and the major scientific community is an essential health service. I would again argue for not trading it off with tuberculosis or any other essential service. Our people deserve all the essential services. Okay. Promotion of family planning methods, RH provision by national and LGU, no? National government and LGU. And one of the biggest lies that I keep hearing is that it changes the abortion law. However, it does ensure that if women come to the hospital for treatment of abortion, whether spontaneous or induced, that they're treated humanely and correctly. Many times, women die when they go to the hospital after abortions because they're not paid attention to or they're judged. And no woman naman should judge out of moralistic behavior of doctors. Kaya nga, si Doktora medyo mas mabait siya sa mga kapwa namin doktor. Kasi ako, alam mo daw, when you know your profession and you love it, mas lalo mong naaamoy yung baho. Kaya ako medyo, maraming doktor na tarantado dyan, okay, maniwala. Okay, so, and then I must admit it's not, present company not included, please. I don't want any of that thought. Okay, so no demographic target. Go ahead. Okay, now, what are the three pillars of reducing maternal mortality and increasing the maternal health? It's skilled birth attendance, access to emergency obstetric care, and reduce of maternal death. No? Don't like this slide, or maybe it's in another slide, but never mind, let me make my point. The three pillars to reduce maternal health, not there, is skilled birth attendance, access to emergency obstetric care, and access to family planning. If you saw Doctora's slide on the 3 delays of that lead to maternal death, where she argues against family planning. That we participated in that study, the Philippine version of that study, which was run from Columbia University in New York by the Averting Maternal Mortality and Disability program of Columbia University, headed by Lynn Friedman and another doctora. I'm just aging, I can't remember. And if it's that study that we're referring to, and I think it is, kasi yung 3 delays framework, galing yan dun sa AMDD study, yung 3 delays sa slide ni Doktora. Sinasabi ng 3 delays framework, yung averting maternal death and disability study, nakasama ang access to contraceptives for reducing maternal mortality. I'm not sure if we're talking about the same study, but that study was the first to talk about 3 delays, no? So it's there. And then of course, kasama talaga yung other 2 elements, stillbirth attendant and access to emergency obstetric care. Next. So, what is it that we want in family planning? Of course, a full range of family planning in accredited facilities and hospitals with PhilHealth support for 3 years for the poor. Family planning supplies as essential medicine, another contradiction me and the other doctora have, and DOH procurement and distribution of FP supplies, family planning supplies. Let's look at this further. Sige. Okay, here, Doctora earlier challenged us to say, where in the medical books, will you come back? Alert. Where in the... Galit yata yung Diyos nila Doktora sa akin. Joke lang, Doktora. Okay. She earlier challenged us to say, where in the medical textbook, or who among us does not think of conception or fertilization as the beginning of life? So here's the answer, no? Contraception is clearly distinguished from abortion. In fact, they don't consider it abortion because contraception is the intentional prevention of pregnancy through the use, first definition, no, of various devices, sexual practices, chemicals, drugs, or surgical procedures. Diba? Based on this definition, yung gay and lesbian sex pala, yun yung contraception. Falls under sexual practices. Okay. Pregnancy is, I really think our POMCOM should encourage homosexual lifestyles to reduce population control. I should add that as a woman's health advocate, I'm always been against population control. Those of us who went to Cairo did it for 2 reasons. To give women a choice against population control and against those who would like us to give birth up beyond our capacity to render ethical, autonomous decisions about our body. Okay, so that's that. Pregnancy is established when a fertilized egg implants on the uterine lining. So notice, it's not fertilization, it's implantation. And who would say this? The U.S. Food and Drug Administration, the American Medical Association, the American College of Obstetric and Gynecologists, the International Society of Obstetricians and Gynecologists, and the medical textbook, Williams Obstetrics, and let me note 22nd edition. I have met, in this long debate for our age among doctors, I've met people who do cite Williams, but it's the 11th edition. So walang paalam po sa inyong lahat, 22nd edition na po tayo. Iba na po ang medical science, and we should take note of these developments. So, abortion, according to Williams Obstetrics 22nd edition, ito yung medical book, is the termination of pregnancy, either spontaneously or intentionally, before the fetus develops sufficiently to survive. That is, prior to 20 weeks gestation or less than 500 grams birth weight. So, ganun pa yung definition. Let's